Hi, my name is Dr. Elizabeth Walsh, and I'm a research scientist and lead the Neuroscience of Driving team at the Center for Injury Research and Prevention at Children's Hospital of Philadelphia. In this video, I will be discussing our study entitled Driving Skills at the Time of Licensure Predict Crash Risk in Newly Licensed Young Drivers. Motor vehicle crashes remain a leading cause of death and injury in U.S. adolescents. Newly licensed young drivers have the highest risk of crashes, particularly in the first few months after getting a license, when they start driving independently. Inadequate skills seems to be one key cause. The vast majority, 75%, of young novice driver crashes are due to driver errors, including poor scanning, speeding, and being distracted while driving. However, not every young new driver crashes. Only 20%, that's 1 in 5, crash in the first year after licensure, and there's variability in who's at risk. If we can identify individual factors that contribute to increased crash risk for some before licensure, this means that we can direct resources to those most at risk and hopefully reduce crashes in the early months of licensure. Our prior work showed that performance on a virtual driving assessment of driving skills delivered immediately before the license exam in Ohio can predict failure on the on-road exam, helping to identify those underprepared for safe driving. Using this virtual driving assessment that exposes drivers to common serious crash scenarios, we sought to determine if skill deficits measured at the time of licensure contribute to crash risk in the first year of independent driving. To answer this question, we analyzed this unique data set of linked licensing records, crash records, and virtual driving assessment performance results in 16,914 young drivers under the age of 25. With the outcome of time to first crash after licensure, a Cox proportional hazard model was used to estimate the risk of crash as a function of virtual driving assessment performance. In the following section, we highlight some key findings. Our study confirmed that new driver skills at licensure were a predictor of crash risk post-licensure. Drivers classified as having no issues on the virtual driving assessment had a 10% lower than average crash risk. Drivers classified as having major issues with dangerous behavior on the virtual driving assessment had an 11% higher than average crash risk. One important limitation that we could not control for is exposure, or the number of miles driven. Future studies should account for differences in driving exposure when predicting crash risk. Our findings take us a step closer to precision crash prevention, identifying drivers most at risk of crashing and intervening before crashes occur. The virtual driving assessment, with its automated personalized feedback, provides a new option for pediatricians to consider as part of adolescent screening, hearing, vision, and a virtual driving assessment. We want pediatricians to include teen driver safety as a routine part of adolescent preventative health care. Promoting graduated driver licensing, encouraging driver training and parent practice, and administering the virtual driving assessment are practice-based strategies to help families ensure that their teen's first independent ride is a safe one. Pediatricians are key to preventing young driver crashes, a continuing public health crisis. Children's Hospital of Philadelphia has a clinical model to follow based on decades of research.